Now, live from Whitney Media, 1460 WVOX, The Greenberg Report, with Greenberg Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner. I'm the Greenberg Town Supervisor, and there's really nothing more important than health, because you can have all the money in the world, but if you don't have your health, you're not going to enjoy your quality of life. So with me today as our special guest is Madeline Zevon, and Madeline is a co-chair of the Healthcare Committee of the League of Women Voters of Westchester and New York State, and Joanne Reich, who's also a member of the committee and is involved with the Greenberg Healthcare Advisory Committee. And maybe we could start and we're going to be talking about the New York Health Act during this program, and suggestions that could improve your access to health care. Maybe we could just start by asking, Madeline and Joan, tell us a little bit about yourself and what got you interested in healthcare.
Well, I've been a member of the League of Women Voters for many years, and about 10 years ago, we invited a speaker to one of our programs, and he talked about the New York Health Act, the single-payer bill in New York. And it's like a light lit up for me, and it just made so much sense. And I decided to get involved. And I started the committee in Westchester. It's a league committee. We have 8 local leagues in Westchester, and the committee represents all of those leagues. And, well, I don't know how much you want me to go on.
And Joan, what got you involved? You've been on my program before, so.
Right. Well, I've been an internist. I've worked for 20 years, and now I left medicine and I'm volunteering, and I'm at the Greenberg Health Center, and I found out about the Healthcare Advisory Committee. I know now that not enough people are insured, that people can't afford services and their insurance, so I decided to help get involved in this committee.
I'd like to ask another question. New York is one of the more progressive states in the nation, and why don't we have a Health Care Act right now? I would think that New York would be way ahead of the rest of the country.
Well, we are, because we're very fortunate that in the Assembly we have someone like Assemblyman Richard Gottfried, who's the head of the Health Committee for the State Assembly, and he has passed many health care bills over the years, and that's why we're better off than some of the states. But this is his major bill, and he has been sponsoring this bill for over 20 years. The man does not give up.
And what is different? What if the New York Health Act gets approved, what would happen?
Well, everyone would be covered, 100% of the residents of New York State. Everyone would have the same health care plan, rich or poor, young or old. There'd be one plan. That's why it's called single payer. There would be no insurance companies, no private insurance companies. It would be like Medicare for all. It would be more comprehensive. It would include all necessary primary care, preventive care, specialists, prescription drugs, mental health, substance abuse treatment, reproductive health, physical rehabilitation, dental, vision, hearing, and long-term care. More comprehensive than even some Cadillac insurance plans.
Another question is, Elizabeth Warren is becoming more controversial because some people want to have choices. Would this take away the right of choice? Will we be getting in the same controversy that we're seeing at the national level?
Well, you can imagine the insurance companies are not happy about that. We're talking about the demise of private, for-profit insurance companies in New York State. So, and we're talking about negotiating with drug companies to lower the cost of drugs. This is what would be paying because we'd save so much money by eliminating the insurance companies. But back to your statement about choice, most people care. They want the choice of doctors or hospitals. That's the choice they want. The insurance company doesn't really provide treatment. They're like a middleman. It's hospitals, it's doctors that provide the treatment. So I think that that's some misinformation that the opposition is perpetrating to confuse people.
We have to take a break, and we'll be right back. And we're going to talk about health care in New York State.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, my name's Paul Feiner. I'm the Greenberg Town Supervisor, and we're talking about an issue that could be implemented at the state level that's being talked about at the national level, and that's health care. Should New York adopt the New York Health Act? And my guests are Madeline Zevon, and Madeline is co-chair of the League of Women Voters of Westchester, New York State Healthcare Committee, and Joanne Reich, and Joanne is a member of the committee and also involved with healthcare at the Greenberg level. The question I have is, what percent of New York doesn't have health insurance right now?
Only 5% of New Yorkers don't have health care. But the issue is it accessible? Because of very high deductibles and copay cost sharing, many people who have insurance can't afford to use it until some catastrophic event happens. And of course, the earlier you get treatment for a medical problem, the better, because otherwise it progresses. So for a typical insurance policy bought through the marketplace, the deductible is many thousands of dollars. What happened is there were supposed to be supplements to make it affordable, but when the government took away the mandate for everyone to buy insurance, the supplements diminished, and so the copays make it inaccessible to afford health care because of the high deductibles.
It's going to be interesting. The state assembly passed the legislation twice, but they passed the legislation, I think the assembly passed it by a very large margin, a 2/3 margin.
It passed for 4 years in a row.
Did it pass last year?
It wasn't brought up last year.
Right. Sometimes with the state legislature, the House passes a bill if they feel that it's not going to pass the other House. Now that the Democrats control the Assembly and Senate, do you think that the legislation will also pass the Assembly?
Yes, of course. You're very right. It was impossible for the bill to be enacted because it was never brought to the floor of the Senate for a vote. So now that choice has increased dramatically, that's when the opposition has really ratcheted up their offense. You can imagine if this bill eliminates private insurance companies in New York State and is going to negotiate with drug companies to drastically lower the cost of drugs, such as Canada and other countries pay like half the price that we do for drugs manufactured in this country. So now that this is a real possibility that the bill is going to pass, they've increased their misinformation, scaring people, telling them that this is unaffordable, when in reality, it saves money. If this bill is enacted, even covering everybody with more comprehensive care, it will save New York State $11 billion a year. 90% of New Yorkers would pay less than they do now, even though it's much more comprehensive and everyone will be covered.
I have another question. This passed the Assembly. It never passed the state Senate. Democrats now control the state Senate. Is Andrea Stewart Cousins behind the legislation, and is the governor behind the legislation?
The governor said that he supports single payer on a national level, but not on a state level at this time. But we feel the way Romney Care in Massachusetts was an example, and that's what the Obamacare was based on Romney Care. So sometimes states can, in Canada, initially, Saskatchewan was the first province that passed a single payer, and then the rest of Canada went that way. So it can work on a state basis.
Is Senator Cousins backing the legislation, and do we have enough members of the state Senate who support this?
Right now, in the state Senate, there are 31 co-sponsors of the bill, and that's just one short of a majority. Senator Cousins has, and I know her because she comes to a lot of league events, has always been a supporter of the bill. She has been a co-sponsor, and we're hoping she'll bring it up in the next legislative session.
Joanne, what's your feeling? Do you think that the legislation has a good shot at passing?
Well, yes, because it's passed 4 years in a row. And the Senate, initially, it had always been one vote short of majority. Now, with the shift, hopefully this year it could pass. I'm just a little concerned about the power of insurance companies and private doctors and hospitals in getting this covered, because they're a very strong force.
And it's going to be interesting to see how much money they donate to members of the state legislature. In fact, there probably should be a law that anyone who votes on this for or against should not be able to take money from the insurance companies. You know, what's your thought? Do you feel that the legislature, should have a law that would ban donations? Any thoughts on that? Because it seems to me it's legalized corruption. If somebody gives a candidate or an assemblyman $50,000 in donations, they may not be that excited about the legislation.
Yeah, you're very accurate there. The majority of New Yorkers support this. I mean, if they the main goal of our effort, the League's effort, is to educate the public about this bill. And you can imagine, if people understand that this is going to cover everybody, be more comprehensive, and save money, they're for it. But we have the misinformation that is, and the insurance industry and the drug industry have a lot of money. We are a grassroots effort. What we do is we speak to groups. If any groups would like to have a speaker to educate their group, we'll be happy to accommodate them.
Great. So we have to take a break, and we'll talk about New York healthcare. And if listeners have questions or want to comment, you can call 636-0110.
1460 WVOX.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner. I'm the Greenberg Town Supervisor, and my guests are Joanne Reich and Madeline Zevon, and they're involved with the League of Women Voters of Westchester and New York State, the Health Care Committee, and we're talking about the Health Care Act, which is a proposal. It passed the State Assembly 4 times. It never passed the State Senate, although Senator Cousins, Andrea Stewart Cousins, is behind the legislation, and we'll see if it gets to the floor. Does the entire Westchester delegation support the legislation to the Assembly and Senate?
I believe so, yes. Yes.
So it has support from senators and Assembly members from from Westchester, from this area. The other question, and again, for people who just are tuning in, this legislation would cover all medically necessary services as primary and preventive care, specialist care, prescription drugs, mental health, substance abuse treatments, reproductive health, physical rehabilitation, dental, vision, hearing, and long-term.
Right, long-term care.
Now, the next question I have is, would there be a cost to taxpayers? And what's the cost, and how will it be paid?
It would be paid for with a progressive tax, similar to the way Medicare is paid for, and also plus taxable non-payroll income, such as dividends, capital gains, interest, and investments distributions.
So,
but 90% of New Yorkers would pay less than they do now.
Because they won't be paying for their insurance.
Right. They won't pay for premiums. They won't pay co-pays. They won't pay deductibles. And so right now, like the cost of Medicare, the overhead for Medicare is about 2%. The cost for private insurance is about 30% because of its profit making. CEOs get huge salaries. It's just the paperwork. You're dealing with multiple insurance companies, and each one has their own systems, and it's very expensive to process. Doctors and hospital have to hire multiple clerks to process these. Doctors have to argue with insurance companies to get reimbursed. So all of that is very wasteful, very costly. So that would be eliminated.
So that's so interesting. Joanne, if people want to get involved in this, do you have any advice for them?
I guess write to the legislators, maybe get in touch with our committee and see if there's anything they could do to help. I think the powers in government, I'm not really sure what else they could do to voice their opinion.
Would you have any advice what people could do if people want to support this legislation?
Well, our goal, and we're a grassroots organization, is to just educate the public about what this bill is about. I'm just amazed that educated, well-read people have never heard of this bill, and it would affect every single person in New York State. And it really has been moving through our state legislature, and people have never heard of it. So I would, if there are any groups, any religious organization, any groups that would like to learn about it, all they have to do is contact the League, contact me, and we would be happy to provide a speaker for their group.
But again, and this I'll never forget when I was starting my career, I pushed for legislation, and the person who was sponsoring the legislation came out against it. She didn't realize, she forgot that she sponsored it, and I'll never forget that. And the concern that
they're busy sometimes with so many.
Or from my experiences with Albany, sometimes they sponsor legislation when they think it's not going to pass. And when they think it's going to pass, then all of a sudden they get cold feet. So, the concern that I have, about this legislation is last year you mentioned it did not get through the state assembly, but it got through the assembly when they didn't have a progressive state senate.
Mm-hmm.
So the question is, are the assembly people who voted for the legislation for 4 years when they knew it wasn't going to pass the Senate, are they now really not as supportive of the legislation because they don't want to put the Senate in a bind where the Senate has to vote it up or down? Do you follow?
Yeah.
Do you follow what I'm saying? I mean,
there's two things about that. One, legislators are elected by the people.
Right.
So the people, if they're educated, would have a strong voice in this. And the other thing, it's very expensive for candidates to be elected, to run candidacies. And so you can imagine how generous the insurance companies and the drug companies are to these legislators. And so let's hope they have integrity and they vote the way their constituents want rather than their donors.
Well, that's why maybe if I could give you advice from because I used to be a political activist before I got in office, is maybe the league should ask all the legislators from both parties not to take money from the insurance companies. Because the thing is, if you could get commitments from members of the state Senate and members of the state assembly that they're not going to take a penny from the insurance, companies, then they could vote on this on the merits, whether they're actually for it or against it. But they're not going to be influenced by, by big dollars. Because otherwise they'll just say, I'm a co-sponsor, I'm for it, and you'll be happy, and you'll say, oh, they're friends, when they may not really be pushing to get the legislation through. I mean, does that make any sense to you?
100% accurate.
Yeah.
But the league, one of their main things that they've been fighting for years is campaign finance reform. And the league has, single-payer health care has been the league's policy since 1992. They have policies on a lot of different issues, but I would say things around voting, like campaign finance reform, is one of their major. And they've been doing everything possible to educate the public how important it is for campaign finance reform. And I'm hoping with this new Senate legislation, Andrea Stewart-Cousins they've passed so many bills that have been held back for so many years, and they have a lot, that they're pushing a lot of reforms, and so I'm hopeful that this will pass.
And again, I want to.
Although I do agree with what you say, that's the reality.
Yeah, and I want to mention again that the bill would have a net savings for New York of about $11 billion.
Right.
And that would be savings from reduced insurance administrative costs, reduced hospital and doctor administration costs, and reduced prices of drugs and medical devices. And I think you've estimated that could be like $55 billion?
Yes. Well, 11 billion, I think. We'll save 11 billion.
It would be 11 billion.
Yeah.
So we have to take a break. And then I also want to talk after the break about any possible waivers from the federal government. So we'll be back right after this brief break, and we're talking about the New York Health Care Act, and should New York do what's being talked about at the national level? It's one thing to point fingers; it's another thing to act when you have the ability to act. I'm Paul Feiner, Greenburgh Town Supervisor.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
I'm Paul Feiner. I'm the Greenburgh Town Supervisor, and we're talking with Madeline Zevon and Joanne Reich about health care, the New York Health Care Act. Should New York lead the nation and do what they're talking about at the national level now. For some people who feel that, oh, this is going to be expensive, we talked before the break, there'd be a net savings for New Yorkers of about $11 billion. Now, let's say you're concerned about your real estate taxes. During the break, Madeline mentioned that there's good news for those who don't want to pay property taxes.
Well, it would cut down. Most of the property taxes go for two things, schools and Medicaid. So Medicaid would be folded into the New York New York Health Act.
So that's like half of the county budget, isn't that?
Yes, yes.
So New
that
York
would be eliminated.
That would be an enormous savings for residents. When you're really looking about duplication, so much of what Westchester County funds is basically mandated by the state.
Right.
So the Medicaid would all be assumed by the state. So a budget of over $1 billion would be half.
Yeah. Yeah, well, Medicaid is paid for federally and statewide, but the county portion would be eliminated.
That would be fantastic.
Yeah.
Now, I'm a town supervisor in Westchester, and we pay a lot of insurance. Part of our taxes go to cover insurance costs. Would that be impacted?
Well, yes. Schools and municipalities and businesses would save a lot of money because they would not have to insure their employees. That would save a tremendous, like something like 40% of the school budget goes to pay for health insurance for their employees. So schools could use the money for other things.
So let's say there's a mom and pop business on Central Avenue.
Yeah.
They would not have to pay the insurance for their employees.
Yeah, well, a lot of small businesses don't cover their employees. And so the employee, if they want to self-insure, they have to pay
Right.
Enormous amounts. This is a progressive way of paying for it, so that it's true that the very rich will pay more, but 90% of the population of New York would pay less than they do now.
What when you say very rich, what do you consider very rich?
Well, it's, as I say, it's progressive, so it depends. It goes up. The top 1% will pay a lot more, but they can afford it.
Now, some people will say, oh, you know what, you're a socialist. This is socialized medicine. Would you consider this socialized medicine?
No, it's public-private the way Medicare is. So doctors and hospitals would remain as they are now. The difference is they would submit the claim to the New York Health Trust Fund and be reimbursed by them. So that's what we're talking about. We're not putting a middleman between the doctor and the patient. I believe when a doctor recommends a certain treatment, he knows what he's talking about, or she's talking about. We don't need anybody to get in the way of what the doctor is prescribing for the patient. And that's very often what happens because they're profit making. You know, they have to think of their shareholders and that sort of thing. I believe that healthcare does not fit the market model. Just the way we have, well, you could call it the fire department is for everybody, schools are universal, and so I believe healthcare falls in that category.
In terms of the grassroots effort, people could write op-ed articles. Has there been a lot of newspaper coverage recently on this?
In local newspapers, there hasn't been anything. I mean, you read articles in the New York Times about the national single payer. but I haven't read anything about the New York Health Act.
So one of the things people may want to do is write letters to the New York Times and some of the New York publications and try getting this to get more attention. In fact, I would think that because there's so much national interest in the national law, that the New York media and the national media may want to focus on this proposal because it does have support from the League of Women Voters and from many members of the legislature. Okay, we have a call. Good morning. I'm Paul Feiner. Hi.
Hi, how you doing? I'm enjoying the show. I had to step in and out of the room. I don't know if I heard everything. Maybe you already answered these questions. But here's one of the things that I like to hear a thought about. New York State is presently facing about a $6 billion budget shortfall. And from what I understand, the proposal of this law will greatly increase the need for state taxpayer support. What is the estimated amount of support needed? That's the first thing. And then, Mr. Feiner, I don't know if you were planning on having anybody who might be opposed to this law on your show, but I'd like to hear that side as well. And then I'll hang up and hear what you have to say.
Would you like to answer that?
Okay, I'm not an economist, but the RAND Corporation, which is a very esteemed research organization, the top research organization in the United States, has done a study of the New York Health Act, and they've done the national study, many studies, and they have found that with the New York Health Act, we can cover everybody in New York State more comprehensively, including long-term care, which is very expensive, and still save money. So it's not, people hear taxes, but what they're paying now for their premiums, for their co-pays, for their deductibles, add up to more than the taxes do. So this will save 90% of New Yorkers money.
And as we said during the break, the property taxes in Westchester would go down. One of our biggest problems in Westchester is that we're the highest taxed community in the nation. And if we could figure out a way of reducing the real estate taxes, it would make property values go up.
Yes.
I've always said, do we really need a county government? And you're taking away a big chunk of county government if you basically don't pay for Medicaid.
The money can go to better uses.
And better services.
Right.
I think it's really very interesting. And I think what you really have to do in the coming year before the legislature votes on this is highlight the savings that the average person would have. Because a lot of people are going to say, I don't want to see my taxes go up. This is going to cost so much. But if we could highlight the fiscal impacts to the average person, then I think people are going to be more open-minded. Would you say that's accurate to the caller? Oh, is
the caller there?
No. And we ran out of time. I'm Paul Feiner. I'm the Greenburgh Town Supervisor. This is so interesting. I'm so glad that Joan and Madeline, that you've joined us on today's program, and I'm definitely going to be following this, and I'm going to encourage people, constituents of mine, to pay attention to the proposed law, because I don't think a lot of people are paying attention.
Can I say one thing? I recommend that people go online and Google nyhcampaign.org, and there you can see the bill, you can see the economic study, you can get your questions answered, and I recommend, that's once again, NYH, that stands for New York Health, campaign.org.
Thanks. I'm Paul Feiner, Greenburgh Town Supervisor. I'll speak to you next week. Thanks so much. Thanks.
1460